Hello friends, I am Deshmi. Welcome to SRS Info. Today we will continue with nutrition and health. We completed fat soluble vitamins in the last class. Today we will continue with water soluble vitamins. And these are the main vitamins which are water soluble. And these water soluble vitamins are belong to the group of vitamin B complex. Commonly we call them as vitamin B complex. Thiamine, riboflavin, niacin, pyridoxine, folic acid, cyanocobalamin, ascorbic acid. These are the main vitamins which are water soluble. Today we will cover thiamine, which is known as vitamin B1, also called as anti-neurotic vitamin. Okay, these all are the name of thiamine or vitamin B1. Anurin, anti-neurotic vitamin, all these are the other names of thiamine or vitamin B1. And this is an essential micronutrient. One thing you have to be noticed is that vitamins are not produced in our body. Vitamins are to be supplied to our body. That's why vegetables and fruit intakes is very, very essential for healthy living, because vegetables and fruits are rich with vitamins. And these vitamins are, even though these are micronutrient, but these micronutrients are very essential and play a very important role in our health. This cannot be made in the body, so that it has to be supplied through our food. Vitamin B1 or thiamine has very important medical uses or medical properties, so that it is commercially synthesized as medicines to be a dietary supplement or medication. In both form we can use thiamine. Okay, and this thiamine is very essential for, or this plays a very important role in the metabolism of glucose, amino acids and lipids. And metabolism of these glucose, amino acid and lipids are very essential. We already know about it, how important is the metabolism of these products. And thiamine or vitamin B1 is also involved in many cellular processes, especially for the development of mitochondria. What is mitochondria? Mitochondria is the powerhouse of our cell, which is the powerhouse of cell, and this thiamine involved in many other cellular processes, one of which is mitochondria development. Okay, and the medicinal form of thiamine is included in the list of essential medicines, which is published by WHO, World Health Organization. Clear? Thiamine is used as medicine and also as a dietary supplement. For the medicinal purposes, we use the synthetic derivatives of thiamine, and these are the main synthetic derivatives: benfotiamine, fursultiamine, sulbutamine, etc. So these names you have to remember, and this is very important for your exam also. These are the common synthetic derivatives which are used as medicines, that is benfotiamine, fursultiamine, sulbutamine, etc. Most important thing is, this is the first water soluble vitamin which was isolated from rice bran. And who did it? Mr. Umetaro Suzuki, who was a Japanese agricultural chemist. And when did he do it? In 1910. Do you know about the history of thiamine? There is an interesting story about it. In 1897, there was a Dutch military doctor called Christian Ejikman. He did a wonderful observation, an experiment, and he observed that the polished rice, the rice which removed the bran, okay, this is called polished rice. This regular use of the polished rice leads to paralysis. It was a wonderful observation did by Christian Ejikman. And he also observed that when the use of this polished rice is getting reduced, then the paralysis become released. Okay, so there is a connection between the paralysis and the rice bran, that is, those substances which give the roughness or the covering of the rice. When we polish the rice, what will happen? The outer covering, it contains many micronutrients, okay, and these micronutrients get removed, and this polished rice has no nutrient. There is no supportive nutrient in this rice. But when we use the unpolished rice, then all these nutrients get into body. which make our body healthy. So that's why it's called as polished rice is not supporting. We have to use the unpolished rice. This unpolished rice contains thiamine. He discovered this connection, and in later on 1929 he got the Nobel Prize for medicine and physiology. And later in 1910 Mr. Umetaro Suzuki isolated this vitamin from this rice bran. Okay, this is the interesting history of thiamine or vitamin B1. Now, thiamine has both medicinal uses and dietary uses. Okay, what are the medical uses of thiamine? Why thiamine is important medically? Thiamine has a capacity to give the parenteral supplementation for pregnant women. Thiamine being preferentially sent to the fetus and placenta, especially during the third trimester. So, throughout the pregnancy, thiamine plays an important role. That's why for pregnant women, thiamine is also given as a dietary supplement. Okay. And for lactating women, even after delivery, it also plays an important role. How? For lactating women, thiamine is delivered in breast milk. And this is a natural process. The breast milk consists of thiamine. Increased release of thiamine through breast milk may lead to deficiency of thiamine in women, but still it's essential to give this thiamine to children, to the infant through this breast milk. That's why breastfeeding is very important for the mental and physical development of infants. And pregnant women with hyperemesis gravidarum. What is hyperemesis gravidarum? It's a pregnancy complication which is characterized with high level of vomiting, nausea, dizziness, etc., weight loss. These are the symptoms of this hyperemesis gravidarum, which is occurred during this pregnancy time. For this type also, thiamine plays an important role. Thiamine deficiency may lead to this type of diseases. So, throughout the pregnancy and even after pregnancy, women need the good support of thiamine for the well being of themselves and their babies. And this is also important for mitochondrial development, as I have already told you. For the cellular process, thiamine plays an important role, and mitochondria present in cell, which is also known as the powerhouse of the cell. Again, for the mental and physical development of infants, this thiamine plays a very important role for brain development of the infant. The deficiency of thiamine in infants leads to sudden infant death syndrome, which is known as SIDS. So now you got the point that how important is thiamine for lactating women, for pregnant women, for infants. Throughout the growing time, thiamine plays an important role. All these points are very important for your knowledge and also for your exam. For the medicinal uses, how much safe is thiamine when we use thiamine as a medicine? Generally, it's well tolerated and non-toxic when you administer this by oral route. As a tablet, it's safe. The studies are not showing any more difficulties, but some type of adverse side effects have been reported when you given it as IV intravenously. And the side effects which have documented are allergic reactions, nausea, lethargy, impaired coordination, etc. Impaired coordination is an important point. This may due to lack of the nerves coordination. Neuro coordination is impaired, which leads to lack of well coordination. Clear? And even the thiamine is very important, but this is a micronutrient. Okay, so the requirement is very less, 2 milligram per day, and this 2 milligram is very important. So, if our body does not have this much of sufficient vitamin B1 or thiamine, what may be the possibilities or what are the deficiencies may occur due to this lack of thiamine? The most important and most complex deficiency is beriberi, and this is a complex deficiency of vitamin B1 with the characteristic neuropathy. Thiamine is very important for the healthy function of nerves, neurons. Okay, that's why it is known as antineurotic vitamin. It gives health to nerves, and the deficiency of which leads to the deficiency or improper functioning of neurons or nerves. That's why it is known as antineurotic vitamin. And beriberi is of three types. What are they? dry beriberi, wet beriberi, and acute beriberi. Let me explain. What is dry beriberi? It affects the nervous system. Dry beriberi affects the nervous system. Wet beriberi affects the cardiovascular system, and acute beriberi affect children. Okay, these both of these are found in adults, and this for children. Dry beriberi affects the nervous system, which results in the numbness of the hands and feet, confusion, trouble moving, pain, etc. Clear? All those functions which needs the support of nerves may adversely affect by the deficiency of thiamine, which leads to dry beriberi. Clear? And what is wet? Wet beriberi affects cardiovascular system, that is heart, which are resulting in unbalanced heart rate, shortness of breath, leg swelling, etc. Okay, these adversely affect the cardiovascular system. And the third one is acute beriberi. Acute beriberi found in children. What are the symptoms? Loss of appetite, vomiting, lactic acidosis, changes in heart rate, enlargement of heart. All these are the symptoms of acute beriberi which affect children. Clear? So beriberi is very important. And Wernicke's encephalopathy. This is also a form of dry beriberi. The disease caused by the deficiency of thiamine, which is a form of dry beriberi. And this is also characterized by confusion, ophthalmoplegia, nystagmus, tremors, mental retardation, etc. What do you mean by ophthalmoplegia? It is the paralysis of eyes, paralysis of the muscles surrounding eyes. Okay, ophthalmoplegia is the paralysis of the muscles surrounding eye. This is ophthalmoplegia. And what is nystagmus? Nystagmus also affects eye. This is the involuntary movement of the eyes, rapid involuntary movement of eyes. Okay, rapid and involuntary movement of eyes is called nystagmus. Then tremors, mental retardation, etc. So Wernicke encephalopathy is also a form of deficiency syndrome caused by thiamine deficiency. Okay, and this is a form of dry beriberi. Dry beriberi affects the nervous system. Clear? That's why it's called as a form of dry beriberi because it affects the nerves of eyes. That is why it leads to ophthalmoplegia and nystagmus. Both of the diseases are occurred due to the uncontrolled, unbalanced nervous system of the eyes. Clear? So this is what is about vitamin B1 or thiamine. In the next class, we will discuss about vitamin B2, that is riboflavin. Hope you enjoyed this video. Thank you.